fall when you're back against the wall, and a bunch of niggas need you to go away. Still going back.
So, I did this whole video like maybe 2 weeks ago. I recorded it about like just how it's been since I've been back home, authorization to test, scheduling my NCLEX, and then a brief little tidbit about senior practicum, right? So I recorded it nice by the lake. It was like really beautiful outside. I worked out that day. I was feeling good. And then I go to edit the video and there's no sound. I had headphones in. I guess I had the wrong ones in. Maybe these are the ones that went through the wash or something, because there's literally like no sound, or very minimal sound. I can't say none because I enhanced it, like while editing, I enhanced the sound as much as I could, but it's barely a whisper. So I'm like, great, now I have to do a whole nother video. So senior practicum is when you're supposed to have autonomy. You're supposed to be able to practice on the floor, building up to the same level of autonomy that as you would as like a regular practicing nurse. So for our school, we got to pick where we wanted for practicum, in the sense of like we had to fill out a paper. We had to list like our first option, second, third options of where we would want to be for practicum. My first choice was oncology, because I was like, okay, well, this is, I mean, it sounds kind of bad to say, but there's a lot of people that are diagnosed with cancer. If I get the opportunity to be exposed to, like, I'm not a cancer nurse, like a chemo nurse, so obviously there's very little that I could do as far as chemo goes, but to just be exposed to like caring for patients, like how you're supposed to handle them and their family, and like just the different aspects of dealing with patients that have cancer, I thought it would be extremely beneficial from a learning standpoint. And then, tools that I could take with me on the floor, and like, something to talk about for interviews and things like that. So that was my first option. Second option was med-surg at a hospital that we have pretty much all of our clinicals at. So I was like, okay, that'd be cool. I'm pretty familiar with like their computer system. I've been on the floor a few times, so I could, go back, see the same charge nurse. Hi, do you remember me? If not, we've been here such and such time, whatever. And then my last option was L&D. And I picked L&D because I had a really good L&D rotation. Now, for my L&D rotation, our instructors split it up. So we had L&D one day, we would be postpartum one day. The hospital we were at, they had baby catchers. Baby catchers do the newborn assessment. So the L&D nurse is with mom, tracking them, contractions, all that, with them helping the push. And then once baby's here, baby goes to baby catcher. Baby catcher is the one that does the newborn assessment. They do the Q15 for their vitals, and they do the bath, they do the immunizations. Then from catcher, after 2 hours, catcher goes to postpartum, and gives report to the nurse about the baby, where the L&D nurse goes to postpartum and gives report about the mom. And then postpartum, you're there for a couple of days or a little bit longer if you hemorrhage or C-section or multiples, or, just whatever's going on. So, and then we got to do NICU for my L&D rotation, and I think that's pretty much across the board. So I had a really good experience. I got to do a lot of things, and I chose L&D because I was under the impression that the hospital, well, I don't know, stupid, naive, thinking that other hospitals would kind of be ran the same way. When we get our assignments, I'm L&D. So I'm like, okay, this is not really my first choice, because initially I didn't really want to work in L&D, but like I said, it gave me, it like sparked my interest with my clinical rotation. So I was open to it. So I was like, okay, that's fine. So we met with our instructor, and we asked her, so how is it gonna work? Like, do we spend, because I think it was like 12 or 16 days. No, not even. It was like a month. Pretty sure it was a month. Okay, so anyways, we're like, okay, so do we spend like a week in NICU? Do we spend a week in L&D? Do we do a week postpartum? Like, how does this work? So our instructor was like,
oh, I'm not really sure how they do it now, because it's different than when I used to work there 100 years ago.
So she asked, and then come to find out, we are only allowed on the postpartum floor. So it was like such a disappointment. I mean, I'm just going to call it what it is. It was a disappointment because neither of us, out of the three of us that were in L&D, wanted to be postpartum nurses. It's very, very, like, repetitive and just mundane, like pain management, get you up and walking after C-section. After 8 hours, you can get up and walk. If mom needs to be immunized, if she needs ROGAM, babies' eyes and thighs, which happens in nursery at this particular hospital. And the bath at this hospital doesn't happen with the mom. It happens upstairs in postpartum. Take the baby to the nursery, give the bath there, put the baby under the warmer. Typically under the warmer is where they do the erythromycin in the eyes and the vitamin K. And if they want Hep B, then you give it. If not, then you don't give it. Yeah, your fetal, well, we did assessments upstairs in nursery also after the bath, because it's the most time that you have the baby in your hands, you're doing things with them, you can see everything, you're cleaning everything, so, it's a good time to do your assessment. So we just were disappointed because it just wasn't as hands-on as we thought it would be, and we all expected L&D rotation to literally be an L&D. Like, we wanted to do the monitors, we wanted to read the strips and track contractions and late D cells, early D cells, see if we could really recognize the whole acronym, like VIL-CHOP, variable, early, accelerated, late, having to do with, cord, head, what is the O? I can never remember what the O is for, or placenta, as far as how it relates to the D cells or how the heart is tracking and what's the cause of that tracking. So VIL-CHOP is very easy, helps a lot on your exams, but we just really wanted it to be that way, hands-on, doing vaginal exams and doing all that, and helping with mom with breastfeeding and assessments of mom afterwards, medication administration, all that. Like, that's just what we had in mind. So we went on the floor, made the best of it. We did learn a lot. We did get to do a lot. We really made the best of it. We had really great nurses for the most part. Every once in a while you do get that nurse that feeds into the saying of nurses eat their young. Not everybody's happy to have a student, and I could understand it, especially in this scenario, because our instructor was so overbearing and very old school, and she had a way that she wanted everything to be done, not only by the students but by the other nurses on the floor, and she made that very apparent to them, and it got to the point where she was making the other nurses on the floor uncomfortable because she would go in and question their judgment and how they're treating the patient, and she just inserted herself a little too far. And it got to the point where the nurses on the floor, not even the nurses that we were assigned to, they would give us a heads up. So if we're walking around helping, getting done helping a patient, coming back to the nurses station, if our instructor was there, they would be like, they would sign to us in some kind of way to be like, oh no, don't come over here right now. Or if our instructor was just giving us another pop quiz, anytime she saw us, it was a pop quiz, anything she was there for. And literally she's like this is my hair right here, right? So she's standing this close to us, you could be turning around and her face is here. No lie, she was just that on us all the time. So our nurses would see that, they get uncomfortable by that, they're frustrated by that, and they're like, why? She makes me uncomfortable, and I'm already practicing, so I could only understand and imagine how she makes you guys feel. So they would take us out of situations too, oh, okay, I need you to help me do something, and then our instructor would be like, oh, do you need me to come with you? No, we don't actually. And then there'd be times that we would go in a room, myself and my nurse, because this is my patient essentially. You start out with two patients, mom and baby, and start out with one room. Then after you get a little bit more comfortable, you're familiarized with the floor where the supplies are and things like that, then you get another room, and they just kind of see what you can handle. And then it gets to the point where your nurse is comfortable enough for you to just take care of the patients while she goes on a break, while she goes on lunch, and you got it under control. And our teachers sometimes would just come in the room, our doors closed, we're treating the patient, and she just comes in. Like, oh yes, my name is so and so, and I'm here to help. And if you have any questions, I'm blah, blah, blah. Like, okay, but we're already in the middle of like changing this lady's pads. Like, why are you coming in here? Like, she's already uncomfortable enough that there's an extra person in here. Now you're coming in here. She's all exposed. She's like, get out, basically. So, whatever. Anyways, so that was that. We made the best of the situation. Like I said, majority of our nurses were amazing. The managers were great. The charges were great. We really made the best of our situation, and we grew to really appreciate our placement and just learn as much and soak in as much as we could from the patients, from the staff on the floor, from the charges, from the other nurses, from everybody. We just took in as much as we could. So it actually turned out to be really great. But initially we were just like, but we made the best of it. So as far as coming home from school, so waiting for my authorization to test was a pain in the butt. It took them like over a month to give me my authorization to test. And it's not even that I didn't have everything done. It's the fact that they were dragging their feet. And when I called the Texas State Board of Nursing, like, okay, on here it says that this isn't complete, but it shows a submission date for it. And it's checked off that it's done. But I also have like a hold on it saying it's not completed yet. The first lady I talked to, after calling them for 2 weeks, no lie, with zero response, no one answered the phone. The phone didn't even have a dial tone. I feel like they just cut the phone off for like vacation or something. They took a 2-week holiday break or something. And the lady just brushed me off like, oh yeah, just wait 2 more days. Like, what do you mean just wait 2 more days? Like, I don't understand what I'm waiting for. And of course I didn't say it that way, but I'm like, okay, well, it's still showing, and I'm like confused as to why it's not clear yet. And she's like, oh yeah, you need to wait 10 business days. I'm like, but I've waited 10 business days already, and I'm still not sure like why. And she's like, oh no, we were on vacation for this and this and this, and you need to wait 2 more days. I'm like, okay, whatever. So by this time it's already been like 3 weeks, but business days and this and that, whatever. So I'm like, okay. So then 2 more days go by, still not done. So I'm like, great. So now I'm like pissed because I finally got a hold of somebody after calling for so long. This lady brushed me off. She told me just wait extra days. I waited the extra days. It's still not done. Now I feel like I'm dumb. Like, I'm wasting all this time. I wanted to have my exam scheduled by now. I wanted to take it soon and all that. Here I'm like 2 months past graduation now. What is this? Just about, yeah, because I graduated November 30th. So about 2 months past graduation. So I'm like, man, like, what's the hold up, dude? I'm trying to just get this done. So I called on Monday, and I called as soon as they opened. Before they opened, because I wanted to make sure the lines were going to be available. So I just calling and calling and calling. Finally, somebody answers. This lady was so nice, extremely helpful. Was like, oh my gosh, honey, for some reason, they put this twice on your account. It was a clerical error. And I should have had it done when I talked to the lady the other day. She should have just saw that because my 10 freaking business days were up. They already showed that I submitted it. They already showed that it was cleared, but there was just some little discrepancy, and she could have just looked at my account, but she didn't. She just was like, oh, you did it what day? Oh, just wait. I'm like, what? Do your job, lady. So she's like, let me go over to customer service, and I'm going to have them do this and da da da. And so she had them remove that, and then she said that once I pass my boards, I don't have to wait 10 days for like an interim license or like it's like permit to practice or whatever. I don't have to wait for that. That's been waived. So we'll see how true that is once I take my exam. But you know what I'm saying. So I just have to get that done, take it. I scheduled my NCLEX. I'm like freaking nervous like heck. I've been doing a lot of practice questions on UWorld because, I don't know, it just works better for me. I'm not one of those people who can just read over everything. It just doesn't really work that way for me. But there's some really good, like, I don't know what the website is. I'm going to try to put it in down below or put in some pictures. It's like drawings of different disease processes, which works better for me because I can't just read through pages and pages. It doesn't work that way. I've been studying and doing practice quizzes and practice questions on UWorld. At this point, I've probably done maybe like 1,500 questions because I do like either 60 or 75 per exam. At first I was taking just one exam a day on that, and then I have a different app on my phone. I'll try to take a picture of that and put it on there. It's like free nursing questions, something, whatever. But it's an app that I have on my phone. So I'll do like 30 questions on that, 60 questions on UWorld. Review. UWorld's really, really good as far as the rationales, which clarify a lot for you. You can break it down by systems if you want to do just maternal, and then medications if you want to do adult health and you want to focus on cardiac, or med surg and you want to focus on cardiac, things like that. Like, it really breaks it down for you. But as far as the testing goes, you can have it as many questions as you want, up to a max of 75, and then you can have it either timed or untimed, and then it'll have this little button you can click for tutor. So it'll time you while you are reading the question and selecting the answer, but once you click submit, if it's on tutor, it'll stop your time, so that way you actually know how long it takes you just to answer the question. And then while you're reading the rationale and making sense of it or creating a flashcard or whatever, it doesn't include that space in between answer submissions. So say you have question 1, it took you 30 seconds to answer the question, but reading the rationale for it, it was like another 2 minutes or whatever. So when you go to question 2, it's only logged for that 30 seconds that it took you to answer the question. So it's pretty good. That way you can pace yourself and figure out kind of what it's like. More recently, I've been taking 2 exams a day, 75 questions in the morning, 75 in the evening, or in the afternoon and in the evening or whatever. I'm just trying to do it more often. And it's just been really helpful. So we'll see how this goes. Like I said, sorry it took so long. I had to re-record a video. At first I was just gonna upload that one, but it's useless. It's great, it's beautiful, it's pretty, it's really nice, but you can't hear anything I'm saying, so it's a waste of time. So yeah, like, comment, subscribe. If you have any questions about submitting things, definitely ask questions. As far as the time frame goes, it's useful to get all this stuff done early. And one tip I will definitely give is that when you are in your clinical, that's the time to ask your professors for a letter of recommendation, like your last week or your last 2 weeks of your clinical. Then ask for a letter of recommendation, because I missed out on a really great opportunity for a residency program because I was waiting for this professor to give me my letter of recommendation that they told me they were going to give me like 4 weeks before, and they didn't end up sending it to me until like 3 days after the application closed, which I made them very aware, like following up, like, hi, this application's closing in a week, this application's closing in 3 days, I'm just waiting on this for my submission. And I asked another professor, she needed the whole moon, the sun, and the stars to write me a letter of recommendation. And then the professor that I asked initially sent it to me, but it was nothing. Like, I guess he forgot everything that we did in our rotation or what, I don't know, but it was just ask your professors in your clinical. It'll make life a lot easier, a lot simpler, and get your applications done early. That way when you graduate from school, all they have to wait on is just your I had to do an affidavit of graduation because I took my schooling in Nevada and I live in Texas. Look into everything, get your background check done early, your fingerprints done early, get any extra. We had to do a nursing jurisprudence. Basically that means a test in the state of Texas to prove that you understand the laws of practicing nursing in the state of Texas. So had to do that before I could even schedule my NCLEX and everything else. Once that lady cleared off all of those things on my account, these little stupid discrepancies, I had it cleared in like 20 minutes. And Pearson View, you are now approved to schedule your exam. Like, it was just whatever. So get everything done early. But yeah, ask questions, please, questions, and then it'll help me figure out what to actually record instead of trying to like just come off the top of my head with things. But my next video will be like closer to NCLEX and like the jitters. I'll try to record the actual day that I go in for my NCLEX, before and after. So far everybody's only had 75 questions. So far everybody's passing, so I mean, hopefully that good juju comes on me and I prepare myself enough to pass this exam. Doesn't matter what anybody else did, I just want to be prepared enough to pass my exam, which I'm working on still. So yeah, like, comment, subscribe. Thank you for watching, and I'll see you next time.